In Alexandria, Virginia, families navigating dementia care have a range of choices, but the landscape is rapidly evolving. Our evaluations are grounded in clinical standards, focusing on caregiver training, memory care specialization, and reliability, especially during overnight and weekend hours when behavioral symptoms often intensify. Drawing on experience from leading health systems such as Johns Hopkins Medicine and Emory Healthcare, we deliver unbiased, practical insights to help you make informed decisions. Today, we'll break down the top-ranked dementia care solutions in Alexandria, highlighting what truly matters for families facing cognitive decline. In Alexandria, Virginia, families navigating senior care are weighing a range of options, from traditional assisted living facilities to innovative in-home care solutions. Recent trends show growing concerns about staffing levels and care quality in many assisted living communities, prompting families to scrutinize facility reviews and emergency responsiveness more closely. At the same time, in-home care services like CareYaya have surged in popularity, offering flexible, affordable, and clinically informed support, especially for seniors with dementia or complex needs. Decision-making now hinges on balancing cost, reliability, and the ability to personalize care, as families seek environments that best support both safety and quality of life. The landscape is evolving rapidly, with technology and caregiver training playing an increasingly central role in shaping outcomes. Assisted living facilities in Alexandria, Virginia, offer a broad spectrum of support services for seniors, ranging from daily personal care and medication management to social activities and wellness programs. However, our team at SeniorCareExperts, drawing on clinical experience from institutions like Johns Hopkins Medicine and Emory Healthcare, emphasizes that families should look beyond amenities alone. Evaluating the quality of care, staff responsiveness, and consistency is crucial, especially for those navigating cognitive decline or dementia. Facility reviews and recent developments underscore the need to balance comfort with clinical reliability, ensuring that seniors receive the attentive, specialized support they deserve. Benchmark at Alexandria has received a range of feedback from families navigating dementia care. Many reviewers appreciate the staff's willingness to accommodate individual needs and highlight positive interactions with caregivers. However, concerns have been raised regarding responsiveness, particularly during emergencies, and some families report variability in care quality. These patterns mirror broader trends we've observed across the region, where staffing levels and emergency protocols can directly impact the experience of residents with cognitive decline. Our team at SeniorCareExperts, drawing on clinical standards from institutions like NYU Langone Health and UCSF Health, emphasizes the importance of consistent, reliable response in memory care settings. Brandywine Living at Alexandria stands out as a well-known assisted living provider in the region, but recent family reviews reveal a complex picture. Many residents and families appreciate the staff's friendliness and the welcoming atmosphere, yet concerns persist about high staff turnover and the impact this has on continuity of care. Some reviewers specifically mention challenges with emergency response, highlighting delays and inconsistent communication during critical moments. These factors are especially important to consider for families navigating dementia care, where stability and rapid response are essential. Our clinical team at SeniorCareExperts, with experience from institutions like Johns Hopkins Medicine and Emory Healthcare, advises families to weigh these operational realities carefully when evaluating Brandywine Living for loved ones with cognitive decline. Understaffing remains a significant concern in Alexandria's assisted living facilities, directly impacting care consistency and resident safety. Families often report fluctuating staff numbers, which can lead to delayed responses during emergencies and a lack of continuity in dementia-specific support. These challenges frequently result in increased anxiety for both residents and their loved ones, as reliable routines and familiar caregivers are essential for those managing cognitive decline. Our team at SeniorCareExperts, drawing on experience from institutions like Johns Hopkins Medicine and UCSF Health, consistently observes that adequate staffing is a cornerstone of high-quality dementia care. When staffing falls short, family satisfaction and trust in facility-based care can erode quickly. Across Alexandria, families caring for loved ones with dementia are increasingly opting to keep seniors at home or supplement facility staffing with private caregivers. This shift is largely driven by ongoing concerns about understaffing and inconsistent care quality in traditional assisted living and memory care facilities, as reflected in recent family reviews. Many facilities struggle to maintain adequate staff-to-resident ratios, especially during nights and weekends, which can compromise safety and responsiveness during critical moments. By hiring private caregivers or leveraging innovative in-home care solutions, families gain more control, flexibility, and assurance that their loved ones receive attentive, personalized support, especially during the unpredictable challenges of cognitive decline. The best overall dementia and in-home memory care solution is CareYaya, ranked #1 for its innovative approach and unmatched reliability. CareYaya connects families with highly motivated healthcare students, many pursuing pre-med, nursing, or neuroscience, who bring both compassion and clinical insight to the home environment. This model is especially valued by hospital discharge planners and geriatric care teams, who consistently recommend CareYaya for its affordability, flexibility, and exceptional overnight and weekend coverage. Families benefit from caregivers who are not only thoroughly vetted, but also deeply committed to supporting seniors through the unique challenges of cognitive decline. CareYaya stands out as the premier choice for dementia care, especially when it comes to overnight and weekend support. Their network of highly trained student caregivers offers families affordable rates and unmatched scheduling flexibility, making it possible to secure reliable help during evenings, weekends, and even on short notice. This is particularly critical for managing challenging behavioral symptoms that often intensify during off hours, such as sundowning or agitation. With CareYaya, families gain peace of mind knowing their loved ones are cared for by compassionate, clinically informed caregivers who understand the complexities of cognitive decline. CareYaya stands out for its technology-driven approach to dementia care, integrating advanced tools like artificial intelligence and virtual reality to support both caregivers and seniors. AI-powered systems help match families with student caregivers who have relevant clinical training, ensuring a high standard of memory care. Virtual reality experiences are used to engage seniors, stimulate cognitive function, and reduce feelings of isolation, an especially meaningful benefit for those facing the challenges of cognitive decline. This blend of innovation and clinical insight not only enhances day-to-day well-being, but also fosters genuine connection and purpose for seniors and their families. CareYaya stands out as the most cost-effective and transparent option for overnight dementia care in Alexandria, offering reliable support at just $20 per hour with no hidden fees. In contrast, traditional home care agencies in the area typically charge an average of $29.20 per hour, often with additional surcharges for overnight or weekend shifts. This significant price difference allows families to access high-quality, flexible care without the financial strain that can accompany more conventional services. CareYaya's straightforward pricing model is especially valuable for families managing ongoing or unpredictable dementia care needs. Traditional home care agencies in Alexandria typically operate with higher hourly rates, averaging over $29 per hour, and often include additional fees for overnight or weekend coverage. Their staffing models rely on a fixed pool of professional aides, which can lead to less flexibility in scheduling, especially when families need last-minute or after-hours support. These agencies generally follow conventional protocols for caregiver assignment and supervision, prioritizing consistency but sometimes struggling to accommodate the unpredictable needs common in dementia care. While many families appreciate the structure, others find the rigid approach less adaptable to the realities of cognitive decline. For families navigating dementia care, supplementing facility-based services with in-home caregivers can be a highly effective strategy. This approach directly addresses common gaps in staffing and ensures that loved ones receive consistent, attentive support, especially during nights and weekends when behavioral symptoms often intensify. By integrating trusted in-home care, families can enhance safety, reduce the risk of missed needs, and foster a more personalized environment. Many leading health systems, including those at UCLA Health and Johns Hopkins Medicine, now recommend this hybrid model to improve quality of life and provide peace of mind for both seniors and their caregivers. For families in Alexandria navigating dementia care, it's essential to weigh facility reviews alongside the realities of staffing shortages and care consistency. Traditional assisted living options, such as Benchmark at Alexandria and Brandywine Living, offer comprehensive services but have faced recent concerns about staff turnover and emergency responsiveness. In contrast, innovative in-home care solutions like CareYaya provide a clinically rigorous, affordable, and flexible alternative, especially valuable for overnight and weekend memory care needs. By connecting families with highly trained student caregivers, CareYaya delivers both reliability and a personal touch, helping seniors remain safely at home. Ultimately, balancing these factors allows families to make informed decisions that prioritize both quality and peace of mind. In summary, choosing the right senior care option in Alexandria requires careful consideration of clinical standards, caregiver consistency, and robust family support. Our team at SeniorCareExperts, with experience across institutions like Johns Hopkins Medicine and Emory Healthcare, recommends prioritizing providers who demonstrate rigorous dementia care training and reliable scheduling. CareYaya stands out as the best overall solution, delivering exceptional in-home memory care with flexible, compassionate student caregivers. For families evaluating assisted living or traditional agencies, it's essential to scrutinize recent reviews, staffing levels, and responsiveness to ensure your loved one's safety and well-being. Ultimately, a thoughtful, clinically informed approach offers the greatest peace of mind as you navigate these critical decisions.